Oh, hello. You are in to see the doctor, right? He's gonna be a little bit busy today, but I think he has a spot for one more patient, if that's okay. Do you want to take that slot? You do? Because it's New Year's and it's kind of late right now. So the doctor's gonna be in, but 10 or 15 minutes or so, and he'll be able to see you. Is that okay? Yes. Good idea. Good. Because that's the only spot we have left until next month. Because we are packed. So, let me get my stuff on and we will get right on that cranial nerve exam, is what it says on my computer over here at 10:30. Okay. Bear with me 1 minute. One moment. Yes, this is all very professional. Just go with it. Yes, that's me. Don't look. That's me. We're good. We're good. We're good. So we're gonna test your cranial nerves, and I'm also gonna check your temperature just to make sure that you're not sick, or that you have a cold or anything. I'm going to be using some Q-tips just to clean up your ears, because not everyone has the cleanest ears. And I'm going to be using these not in your ear, but like on the outer parts of your ear, so you don't need to worry about that. It's not going to hurt. It might tickle a little bit, but that's fine. I will also be using a tongue depressor. That way I can check inside your mouth and make sure you don't have any viruses or sickness or illnesses going on. This is brand new. Don't worry, I have more over here if you're worried about cleanliness. But you are in a doctor's office, so yeah. And then I'm going to have you smell some items, if you know what I mean. They're also flavored too, so they're not the most generic flavors, but I think they will be pretty good. You should be able to guess them right. And then I will be checking your eyes too as well to make sure they're seeing properly and that your blood vessels are constricting and retracting and your pupils and just all that sort of stuff. So that's what this is for. And then we're gonna also, at the very end, give me 1 second, I'm not crying, I promise. It's okay. It's okay. But at the end, we are going to check your heart rhythmia, and what that entails is hooking up some leads to your chest. It's probably right around here, one here, at least 3 or 4 different leads that will hook up to a machine that's right over here, and we will check your heart rhythmia, not the heart. Excuse me. It's pretty much checking the life of your heart, because to make more sense, your heart has a health bar. Think of it as like a health bar, and the older you get, the more down the bar your heart goes, if that makes any sense. So we're gonna check your heart health. Say that 5 times fast. And then we'll just use some of this wrap here to we'll figure it out once we get to that spot. But everything seems right now. How are you doing? I'm sorry. It's New Year's. It's late at night, and I've been seeing lots of patients. So I'm sorry if I'm not in my gown or my full suit, but it is what it is. So yeah, this is just the doctor's office. Like you just kind of did a walk-in. Yeah, that's fine. We take walk-ins, but not normally this late. But I make an exception for you because I've seen you in here before, and yes, I know you, and you probably don't know me too, but that's besides the point. So now that we've got that out of the way, I also have to set up the leads for the sticky pads for your leads. And it doesn't hurt, like I said. It's just there to check the heart health. Everything in your body has a health bar, is how I like to see it. Your brain has a health bar. Your kidneys have a health bar. Your liver has a health bar. And per se, if you're gonna, not you in particular, but people, or if anyone drinks, your lungs have a health bar. And if you're gonna smoke, that's just gonna degrade your health, the lungs. And same with goes for your liver and your kidneys. So try to not drink or smoke, because that is bad. I said yes. So if you want to go ahead and take a seat, and I'll be right with you. You just need to fill out the pad on the tablet there and just answer some questionnaire stuff. And it's just basic. It's free. It doesn't cost anything to answer the questions if that's what you're worried about. And then when you finish up with those questions, just bring the tablet back and we will get right on that exam. Oh, you're done already? You okay, it was just a quick little questionnaire. Let me see that tablet real quick. Oh, thank you. I'm just gonna go over these questions real quick. So you got all of them right. There's no right or wrong answer. I'm just making sure that you answered them, because if you don't, we're gonna have to reschedule. Yes, I know. It's kind of a pain to get in here sometimes, but we do our best. So, sorry. Let's start with your throat. Yes, I know. I'm just kind of winging it right now. Don't mind me. I have a clean, sterile tongue depressor. Open up your mouth, please. Okay, thank you. Just get in there real quick. Hopefully you don't have a gag reflex, because that's kind of embarrassing. But let me just look inside your mouth. Look on the other side. Oh, hold on. I'm just checking real quick. Okay, that looks good. And let me check the other side real quick. Yep, just as I suspected. Oh, what's that? Let me have another look real quick. Yep, it's clear as day. We're gonna have to get in there and do some more tests, if that's okay with you. Don't worry, it's nothing to be alarmed. There is just some slight redness. You do feel a sore throat, like in the back of your throat coming on. You do? Okay. Well, I am going to put on my protective gear just so I don't get any sick, because I can't miss work, because I'm the only one working tonight. So bear with me, and I am going to put my head cap on, and this is all that I'm going to be needing for protection, because can't go wrong with not getting sick. Alright, just making sure we're all kind of there. Got my gloves. We're sterile, so don't do anything. So I also would like to check your temperature, if that's okay, inside your mouth. If you're okay with that. Like I said, it doesn't hurt. It's just to make sure you don't have a temperature, which I doubt you would do, because you seem fine so far, but there could be some underlying little things that we don't know about. So go ahead, open up your mouth. Yes, just like that. And here we go. Hold it. Just hold it there. Hold your position right there. Alright, so yes, your temperature seems fine. No need to be worried with that. It's 74 degrees Celsius. And like I said before, I'm going to check your ears with the Q-tips here. These are brand new, so you don't need to worry. And then I will clean them up, your outer ears, with the gauze. And then after that, we will do the EKG, is what I have. Yep. So let me check your ears. Let me get one of these Q-tips out for you. I don't really have the nails for this, but that's okay. Yeah. So, Q-tip. I'm gonna go ahead and look inside your ear. I'm gonna go over here first. You know, I'm not really seeing it. Yeah, okay. I'm gonna check the other side. You're good. So like I said, I don't really see it over here. Yeah. This side does look a little impacted with wax. And I will have to get that cleaned out for you, because I hear, or I understand that you're having some hearing difficulties. So, the left side did have a little bit of wax, and on the right as well, but just not as much. So I'm going to go ahead and get a new Q-tip and clean out some of that wax for you. So that way you can get a good night rest tonight after you leave the hospital, because it is getting kind of late for the both of us, and you're my last patient for the day. So yeah, let's get this done with. I also have this gauze, so that way you can wipe it down and get it all clean. So let me go ahead and do this. Just stay still and don't move. Don't open up your mouth, because that kind of, your jaw is connected to your eardrum. Not your eardrum, but the inner parts of your ear, basically. So I'm gonna go ahead and get a little bit closer here. And yes, that is perfectly normal to feel that sensation on the left side. Like I said, this is just an ear cleaning. And if you need any assistance, just let somebody know. Don't try and do this yourself, because you could easily damage or injure yourself very badly, and then you will be coming right back into the hospital. So if you need help, just ask somebody, or just come and see me, which is perfectly fine. And we will check the right ear now. So it's showing here that this ear is a little bit less than the other ear, but that's perfectly fine. I'm just trying to get it all. I'm gonna have to fold your ear back a little bit, because there is some crusties back there, but don't worry, we're gonna get it all cleaned up for you. Yep. Oh, did that hurt a little bit? I'm sorry. There we go. Let me dispose of that for you. And let me go ahead and open up this gauze here. And this is very soft material, so as you can see, it's very absorbent. It kind of like a microfiber, if you want to use that as a term. But let me go ahead and use one of these, and we'll clean up just the outsides of your ear. Just hold still. How's that feeling? I feel a little bit better. Yeah, on the right too as well. I'm trying to be as gentle as I can, because I know that it's very painful to have wax build up in your ears, because sometimes if you have a dog or a cat, sometimes the hair can get in there and cause a little bit of pain, but I'm glad that you're here to get this resolved. Yep. Alright. Looking pretty clean. Let me just get this folded up and do one more quick little wipe, and you'll have to get a few more tests done just to make sure. Alright, and then last one on the right. Yep, you're doing good. Doing good. Just stay still. Alright, you did good. And yes, those are my teacher's, not really teacher's pet, but they're my dog in the background. Well, there's two dogs. You can't see the other one, but the other one is just right there. So we gotta be quiet. So, one last step in this exam, and you'll be on your way, is to get these leads. That way I can check the heart levels, or your heart health, sorry. And to do that, I'm gonna get the leads set up here. There are 4 leads. And like I said, this doesn't hurt or anything. It's just gonna send pretty much like radio waves to your heart, and then when your heart beats, every beat your heart makes, it'll send it back, and then that's how you read your heart health. So let me get these leads set up for you. So we're gonna stick one lead kind of like right there, right here. We'll get another lead set up on the other side, adjacent from your left. So this one's gonna be here. Now the other one's gonna be here. We're gonna put right there, and 2 more, kind of on the lower side, under your chest here. Yep. Just hold still. Right there. Last but not least, the other one on the other side. That way we get a good reading. Right there. So, now that we got the leads connected, let me go ahead and connect them to my machine. There's 4, so I'm going to need 4 leads here. And the colors don't mean anything, they just help me to keep track of which one's going which side. So we got 4 right here. These are the leads. They look a little funky, but don't worry, these go into the machine. And then the other end kind of just sticks onto, they're just stuck onto your chest, and here and here and here. So, let me get the first one going. The first color is a brown color. Like I said, it does not matter on the color. It's just there to help keep things organized. So we're going to put the first one on the first side right over here where I put the first lead. It's going to go right about, hold still, I know it's not going to hurt, I just need to connect them. One right there. And get the other one. It's going to be a yellow color. And there's that one. This one's going to go a little bit under, a little bit lower than the first one. So just hold still. You just got to get it right there. Perfect. Alright, hold still on that. Thank you. 2 more to go, and I will get these readings done and sent over to your primary. 1 more on this side. kind of like right there. Yep. And then last but not least, the last one is the red one. That one's always takes the longest, I know. This one right there. Perfect. So, let me go ahead and get a good reading here real quick. It takes 2 seconds. Okay, it's printing out. Let me see. Alright. It's printing because on the other side it prints out a long sheet of paper. So that way we'll keep that. I'll do 2 reads. One for the record for me, and then you can have another record of it for your primary or for yourself. Alright. There's that. Alright, I guess we don't need this anymore because we are out of the 6 zone. And we'll just keep that on for the time's sake. So, now that you have everything completed, just checking. Yep. Thank you for coming in, and if you need to get a reschedule, just let me know and I can schedule that. You do want to get a reschedule, not a reschedule, but for your next appointment, for your follow-up. Okay. So, when are you available? Okay, I'm just going to make a note of it right over here. And then we have, let me see on my calendar over here. So it's saying I am open all next week. Do you want to check the 21st, which is a Wednesday? Okay. And what time would you like to have? In the mornings, afternoons, or evenings? You want a morning? Okay. So we've got you in on the 21st on a Wednesday. Okay. And I hope do you need a business card? You got it on your phone because you get the updates and notifications. Okay. So we hope to see you soon, and thanks for coming in. Thanks.